Good evening, friends. I am Dr. Vaibhav Saxena. I am senior consultant and head urology and renal transplant department in Yashoda Super Speciality Hospital and Cancer Center. I myself being a urologist, I also deal with the andrology or erectile problems of the males and other sexually related problems of males, especially, in which we commonly find a very common, I will not say it a disease, it is a problem, basically mental problem, as patients sometimes come to us and say that they have dribbling of some semen kind of thing per urethra, which they call it as a Dhat syndrome, Dhat syndrome. In eastern UP and Bihar, it is commonly known as a Dhat disease also, and you see many more indigenous persons are treating it and they are prescribing the medicines. However, it is not a real disease. There may be some infection in the urethra or urinary tract or the genital organs due to intercourse or some other reason, which is associated with the secretions, such kind of secretions. It happens only less than 1 to 2% of the cases. 99% of the cases have a psychology. The origin of this psychotic disease, psychological disease, starts right from the adolescence, when the child becomes a man or adolescent at the 12 or 13 years, when the the boy attains the maturity, the puberty. That time the male hormones start rising, which leads to increased secretion of the semen and the prostatic secretions, leading to more formation of the semen. So there is only one outlet for the this thing, that is the urethra. If the person is not sexually active, it will lead to natural secretion of this along with the urine, or at the time of night, which is commonly known as nightfall. Many boys, school going boys, they come to us and they say that after that this nightfall or this Dhat secretion, they have the weakness. But this is not true. This is not a real disease. Basically, there is lack of the sexual education in our system. Still, it is not outreaching up to all the schools, and the adolescents are not being taught about it. Another important problem is they hide, they shy to share or discuss this problem in the community or the parents or the brothers. They mostly, their knowledge is limited up to their peers or the internet, which gives the half or the incomplete knowledge about the reality. So the Dhat syndrome should not be confused with any kind of serious disease. However, if you want a counseling, you can directly consult a good urologist, which will tell you all the realities and he will counsel you. If there is a real problem, he will treat the disease. If you like this video, please share the link and subscribe it, so that this information can be spread in the community for the welfare. Thank you.